ডালবোট, ছোলাবোট, বাদাম, বাদামের প্যাকেট, ডালবোট, ডালবোট, মিষ্টি বড় হয়, টক বড় হয়, ডালবোট, ছোলাবোট, ডালবোট।
Okay, let's start. Good evening, guys. Can you hear me? Hello, someone please respond.
Yes,
Can
Priya.
you hear
Yes,
me?
I-
Okay, that's great. Good evening. And can you hear my? Can you see my screen?
Yes,
yes,
it's visible.
Okay, that's great. Just wait for a while. I'm recording this so that later on someone can see the orientation program. So let's start. I am Dr. Rifat, working as a resident and as a medical officer in Bangladesh. And all of you know my hospital. This is the only one medical university in Bangladesh that is Bangabandhu Sheikh Mujib Medical University. So today we are here to run an orientation program that is for Mrcs Osce exam. And I always used to say that Mrcs Osce exam is one of the most easiest exam I have ever seen. As you can see my profile that I have done almost all the position degrees at least entrance I have passed. So I do have the test of giving the exam of every single sector, but among them, I found the Mrcs OSCE exam is the easiest one if you do know the technique and know how the exam is really conducting. And on the other hand, it is one of the difficult one if you don't know the exam, because I have seen so many candidates over the last 2 and 3 years have failed in the exam because they don't know how to start the preparation, they don't know how to take question. So please guys who are not participating, please mute yourself. Rubina Kafi and so other people, please mute yourself so that we can continue. So as I was saying that it is one of the easiest exam, and on the other hand it is the most difficult exam. Why it is difficult? Because I'm just sharing one of my colleagues experience. He attempted so many tries in this exam and couldn't pass in the exam. But as you know, FCPS final part is the most difficult exam in our country, and he passed in the very first attempt in the FCPS final part exam. So after having the all preparation for the three times for the Mrcs Osce exam, he couldn't pass the exam. But he on the other hand, he passed FCS final part exam with the very first attempt and within with 3 months of preparation. So as you can see, it's not that much easy exam. But why that is, on the other hand, I was just saying that it is also an easy exam if you know the technique, because I have seen so many doctors, especially the youngsters who have recently completed their internship within 1.5 years or those 6 months. They just doing their Mrcs part A exam within the internship, or they attempt in the Mrcs part A exam just after completion of the internship, or even within the internship. But whenever they pass the Mrcs Part A exam, as soon as they found their registration, they try to attempt the Mrcs Part B exam. And I was just surprised. The people really pass in the exam very easily. The main thing, always remember, Mrcs OSCE exam is not the exam of huge knowledge. Just type it in your brain. It's not the exam of knowledge, guys. Just always remember, it's not the exam of knowledge, because the exam that is needed to needed for the Mrcs exam, that has already been seen in your Mrcs Part A exam, because Mrcs Part A exam is the wholly depends on the knowledge. So your knowledge has already been done. Now come to the professional portion, or now to the clinical portion. That's why this exam will judge for, the examiner will look for your professionalism, your competency, how do you tackle the patient, how you uh, correlate the clinical examinations, how do you look for the findings and every other things that are seen in the Mrcs OSCE exam. So first thing, you will have to focus that you are not going to appear for the knowledge exam, rather you are going to appear in the skill portion, right? So with me, I have another my colleague, and he is also helping me in the throughout the course session, especially for the making the books, to updating the books with the most recalls which are not given in our traditional books. So he is working very hard to update those books. So he is Dr. Hasnat, and later on I will give you the platform to say something. So let's start, guys. So at first, how many stations do you have to face in the Mrcs Part B exam? You can see there are total 17 stations. So these 17 stations are for the performing. These are the performing. So you will have to perform. How will you have to perform? I will discuss later on every single way and step by step. But after all, you have to consider that you will have to focus or you have to perform in total 70 stations. There are two preparatory stations. Among the 17 stations, two stations are communication stations. Communication stations, one in phone call and another one is person communication. So before those communication stations, you will have to you will have a preparatory station. So that's why total 17 plus 2 equal to 19 stations you will have to go, and you will have to perform in the 17 stations. So in total we have 17 stations and two stations. One is communication and another one is phone call preparatory stations. So there might be some rest stations. Just why the rest stations are given in your exam. Look, there are almost there are 23 examinee, total 23 examinee. So you will have to you have to focus 17 stations and two rest stations. So at a time 19 candidates can be accommodated in the exam hall. So rest, there are four doctors who are who can't attend in the exam. So is it logical to arrange another session to accommodate only for the four doctors? Is it possible? Guys, someone please respond with me. If there anyone, you can participate with me. So it's not logical to manage another exam session because it's a very lengthy exam. That's why they will give you some resting stations. uh, that not that much four stations, that might be one or two stations, or might be hardly that is three stations, but not more than three stations. These are the rest stations in between the knowledge or in between the skill stations. So you don't have to literally do anything, rather just drinking water, or if you want to go to the washroom, they will guide you to take the washroom, because it's a very lengthy exam, so you'll have to may need to go to the washroom. So these are the resting station. So come to the stations. Total, as I was saying, that there are 7 stations. Among them, 8 stations, and skill stations are 9 stations. Knowledge 8 stations and skill for the 9 stations. Right. Now, time distribution for the knowledge part. So every single, so we come to know that there are knowledge stations, 8 stations. There are 8 knowledge stations. So every single station comprises 10 minutes. Among the 10 minutes, 1 minute to read out the question, and another 9 minutes to perform the stations. So come to the mark distribution of the knowledge part. So there are total 8 stations, 20 marks each stations. So as there are 8 stations, total 160 marks in total. So what about the pass mark? So pass mark basically depends uh, on the other candidates. How do they perform in the stations? So it is called modified Goff method. So it is a percentile way. So they will judge you, whoever found the high score, they will do some percentile, so that by that way pass mark is fixed. So overall, for in my experience, I have seen the pass marks is 160 out of 160. That is about 108, that might be 110, that might be 112. So I have never seen more than 15. I have never seen more than 115 out of 160. So always your focus will have to have more than 150. So if you are if you can secure 150, more than 150 in your knowledge portion, then definitely will pass, inshallah. So that total depends on the stations, how the other participants are doing. Stations distribution, these are the knowledge. So I was saying that you will get 8 stations in the knowledge portion. Among the 8 stations, there are 3 anatomy stations, 3 critical stations, and 2 pathology stations. So total 8 stations, and each of the stations 20 marks. So total 20 marks and 20 marks. So total 160 marks. Did you get it, doctors? Can you get me? Hello, guys. Are you
Yes.
with me
Yes.
or?
Uh,
Okay, that's it. Okay, let's break the anatomy station. So before going to the breaking portions of the anatomy or pathology, I'd like to say, always remember these anatomy and pathology stations are calculated alone, and critical care is calculated another way. Because whenever you will get your answer script or your mask script after getting the result, anatomy and pathology result will be given in a separate portion, and critical care will give you another separate portions. So that's not a matter, but the thing I would like to say, you will get 160 marks. You do have 160 marks here, and will get to 115 marks here to make you pass. But I would say this is the most difficult one among the knowledge portions. Because why it is difficult, I will say later on, but this one is the easiest one, and this one is the another easiest one. So here you will get 60 marks, and here you will get 60 marks, and this one for the 40 marks. So as I was saying, that anatomy and critical care is the easiest portion, because the topics that are given in your all books, whatever the book is, the traditional books, the anatomy sessions are same. You might find in your exam that is a thigh or lower leg or back, even you can find your abdomen, or brain or upper limb or hand. So many stations are given in your books, and that way the exam will come, the questions will come in your exam. But always remember, anatomy pictures that are given in our book, you'll these pictures are only for your orientation, but you won't get any picture directly in your exam. Always remember, as I was saying, this is the easiest one, because how they will ask you in exam, I will just show you later on. But before going to that topic, just remember, this is the easiest one, because every stations are known. So if you do have a proper orientation regarding the anatomy portion, so anatomy is nothing, but you will have to at first identify the normal relation of the anatomy. Then we'll go to the cadaveric picture, so that if you are asked from anywhere, and whenever I will ask you any pictures, and I will ask you what is this, what is the nerve supply, what, so many questions on that topic, depending on that topic. But if you don't have a proper orientation, you won't be able to answer the anatomy portions. So these are the fixed portions, so it is the most important part to acquire the mark. Then come to the critical care portions, you will also get 60 marks here. Always remember, critical care is the fixed station. You will get in your book total, almost total 40 stations, and just write it down. There won't be any new stations, and they won't ask you any station which is not given in your book. So always remember, critical care is the fixed portion. So if you read very hard, and if you can remember everything, whenever they will ask you in your exam, you will be definitely able to answer the critical care portions, because these are fixed portions. So you'll have to work. I definitely will advise you to work on critical care, and especially to the anatomy portions, because anatomy is fixed and critical care is also fixed portion. So if you do go through your books again and again, so you will able to answer every single thing. And come to the pathology portion, and I was saying this is the toughest one. Why it is toughest? Because in pathology station, you won't get all the questions that are given in your book. I am saying again, the questions that are given in your, those are not enough, because you will get so many new questions from pathology chapters. And these chapters, like in critical care, like as example, uh, burning. So they won't ask you any single thing other than burn. So whenever you get the burn station in your exam, they won't go outside the burn. Definitely they will be within the burn. They will ask you so many questions about the burn management, every whatever the question is, but they won't go outside the burn. But in case of pathology station itself, there is no single step, there is no single chapter in pathology, because pathology station, every single station you will get 2 to 3 stations at a time. How the stations will come in your exam, I will show you later on. But remember, pathology station, in case of pathology stations, you won't get a single station, because you will get many tag stations with the main stations. I will discuss with you later on. So you will, these are your term cards. So if you can acquire or if you do have a very proper preparation within the anatomy and critical care, I can assure you you will pass definitely. So let's break the anatomy stations. So as I was saying, there's total 3 stations, 60 marks in total. Now come to the practice portion. Is there anyone who can read the, I won't ask you any question, guys. Just is there anyone who can read out the question? Just unmute and you can read the question.
A
Isn't there?
22-year-old man. I'm starting.
Okay,
Just
okay,
a
okay,
second.
okay, okay.
Okay. A 22-year-old man is attacked by a dog and suffers laceration to the dorsum of his left hand. On exploration of his wound in theater, he is found to have several damaged tendons. Your registrar is assisting you in the theater while you perform the tendon repair.
Okay. So you read out the question. So how the exam is, the exam scenario is. So say it is your exam room and this one is exam gate. So the question that is written here, we have already gone through it. This will be attached in the wall of this room. So this is the question reader. I think this was Dr. Annava. She is this person, and Annava will have 1 minute to read out the question that is attached in the exam gate. So as the question is done, after the bell rang, Annava will enter into the question hall. Please, some who is unmute, please mute yourself, doctors. Please mute yourself. Dr. Hassan, could you please help me to mute them? Okay, that's great. So as I was saying, Anna will get 1 minute to read out the question in the gate, and this is the room, and this is the wall of this room. This is the wall of this room, and the pictures that are the pictures that are given here, the pictures are attached in the wall of this room, right? And this is a table. This is the table, and this is the examiner, and this is Dr. Annava. So the scenario is Annava will enter into the room, and examiner will ask you, have you read out the question? Dr. Annava will say, yes, I have read out the question. And the consultant will take you to the wall and will ask you questions, so many questions for the long 9 minutes. For the long 9 minutes, the examiner will keep you asking so many questions. As an example, I only kept here 3 pictures. So the consultant will ask you, okay, Dr. Annava, could you please go to the picture number B? So this is the picture B. And Dr. Consultant keep asking you, could you tell me the structure C? What is C? And this is C. Okay, could you tell me the function of the structure C? Okay, that's great. Could you tell me what is number G? Could you tell me the structure of the G? Right? Could you tell me what is the picture E? H? Sorry. So then come to the picture number A. Could you tell me what is number B? Now tell me the function of V. What will happen if this muscle become paralyzed, what is the inserting point of this muscle? Now come to the picture number B. D. What is structure B? What is the role of structure B? D. Okay, this is another. This is the bones. So could you tell me what is number C? What is number B? Could you tell me what is carpal tunnel syndrome? Now, guys, come to the another question that is not related with these pictures directly because it is anatomy session, but they will keep you asking carpal tunnel syndrome only for this portion, right? So here it is given, and that's why they will ask you what is carpal tunnel syndrome, what is the treatment, or so many questions about this, what is the nerve that's entrapped here, what will happen, so many questions depending. So I just kept only 3 questions here, but there might be given in the wall 5 to 6 questions, pictures. So they will ask you so many questions, and the examiner, in the examiner hand there will be a board, and he will keep writing the your marking. So if you do have a very proper orientation regarding this portion, definitely you will get some marks. Like few questions I have given: identify structure A to E, which nerve supply the muscle attached to the tendon level B, like this one, picture number A, this one B. Then they'll ask you what is difficult to fully extend the ring finger alone at the metacarpophalangeal joint. You'll have to answer what is the origin and insertion of the extensor carpi alone. The answer is given here. So the examiner will ask you for the 9 minutes, but one thing I can assure you, they will ask you few questions, limited questions, not few. They will ask you so many questions, but the questions are limited. So because if you can answer all your questions, you will come to know that your exam will be finished within 6 or 7 minutes. 6 or 7 minutes, within 6 or 7 minutes. I did very well in my anatomy stations, all the 3 stations, and just got yesterday my mark sheet, because all you now guys, all you know that KL England Center takes few times to send their mark sheet, and I alhamdulillah I got 88 marks out of 100 in the anatomy and pathology. So I can assure you, if you can do very well in the anatomy stations, you will get definitely the full marks. So this is the anatomy, and definitely is a it will act as a trump card to make you pass in the anatomy portion. So let's break the critical care stations. So as I was saying, critical care also there are 3 stations. Each station comprises 20 marks, so in total 60 marks, and this is the same way how it is asked. So one thing remember, in the critical care stations, you will be shown some X-ray, some ECG, some interpretation. Definitely they will ask you few. You will 3 questions, and definitely you will get full blood count. You might get X-ray. You might get some serum creatinine. You might get blood culture. So many questions that will be shown to you, and they will ask you some interpretations. So this is another question. Is there anyone who can read out the question, please?
Post-operative
Anyone,
patient
please?
with chart and
Okay, that's
vital chart inside the station. Patient has taken crystalloids and colloids about 7 liters. 4 liters of them are normal saline. Now he is tachycardic, hypertensive, desaturated, and oliguric.
okay, that's good. Now the examiner will ask you what are the physical expecting physical finding. So what's your diagnosis? So in case of this type of question, you are not allowed to say the diagnosis like fluid overload, something else. You are not allowed to say the diagnosis directly, because I will show you later on, because you do have so many marks, almost 48 marks for the professionalism, and professionalism marks reside especially on these critical care portions. If you guys, I am asking what is your diagnosis. As you can see, there are so many liters of fluid has been given, because adult patient needs only 30 to 40 ml per kg per day fluid requirement. This is the 30 to 40 ml per kg per day. But on that way, you only need 2100 to 2800 fluid. But the patient has given 7 liters of the colloid and 4 liters of the crystal or something else. So this is definitely a fluid overload patient or something else, but you are not allowed to give the answer just only by saying fluid overload. You will have to answer the patient is having crystalloid 7 liters or colloids 4 liters, something like this, and patient is having hypertensive, so many things that might be a fluid overload. So this is called professionalism. Just like you are going to a clinical round in a ward and just your consultant gave you a patient history and he is asking you why this happened, why this happened. So you don't literally know anything, but you are discussing with the patient, with your consultant very smartly, very perfectly. So he will ask you so many questions. Just he found an X-ray in the bedside. He will show you what is the X-ray, what does it show. Could you tell me the finding of this X-ray? So regarding this scenario, he will keep asking you so many questions. So in this way also, this is the exam room, this is the door, and this is the table, and this is your consultant, and this is Dr. Manarat. He's here and he has read out the question here for 1 minute, and after 1 minute he will enter into the room, and this is the chair here, and he will sit down here, and the consultant will keep asking you the questions for the long 9 minutes until you finish your station. But what is the most dangerous portion in critical care? I have told you that critical care is the fixed portion. So if you do have a very proper preparation, you will able to secure more than 50 marks in the critical care. But still, so many candidates can get many more marks here. Why this happened? Now come to this portion. You can see this is a long stem. First, it is a long stem at first. Then, whenever the question is given in the wall, like it is a 4 L4 size paper, so the question comprises the whole page. The question will be written throughout the page, and there will be given not only the question, they will give some interpretations, they will give some another scenarios, they will give some electrolytes, so many things. So is it possible to read out the whole question and memorize every single thing that is written in the question paper? Dr. Manarat, is it possible, bro?
No, because it's a
Definitely
long
not.
stem.
Yes, there's a long stem, and there will be so interpretation will be given in the question, and so many things will be written there. So the most of the candidates who blender by on which way they blender their critical station, just they take 1 minute to read out the question, and as soon as they enter into the room, they will start answering the question. But before starting the question or answering the question, the examiner will ask you, have you read out the question? You need to read out the question again. Definitely he will ask you. So always remember, guys, if you can't read the question and if you couldn't reach your diagnosis by reading the question, just definitely ask for the question again, because your professor or consultant has another question set. So don't dare to start answering the question before reaching the final diagnosis, because the steps are same. But if you can't reach up to the final diagnosis by reading the question in the that is given in the door, because you will be so nervous, so you'll keep forgetting so many things for your sympathetic overactivity. So if you start answering the question, you will definitely can't acquire a good score. So if you can read out the question, so after entering the room, just ask the consultant, sir, I need to read out the question again. So the consultant will give you the question paper again. Just take a deep breath, go through the questions again, and after reaching the diagnosis start answering. Because always remember, in the knowledge portion, if you do, guys, I am saying again, if you do have the knowledge portion, as it has itself 9 minutes, but the knowledge portion will be finished within 5 to 6 minutes. Just remember, time is not a matter if you are well prepared. So always remember, in the critical care station, the most important difficulties that you will face, and that is the time management and reading the question. So in this way, you will ask this question, and you will show some interpretation, some X-ray, some ECG, so many things will be asked you. Now come to the pathology stations.
Excuse me, Dr. Rifat, I have a question. Can I ask a question?
Yes, please. Yes, sure.
If we ask them that we need to see the question again, for example, does that will that reduce our score by any, like, will they cut off a few marks?
No. That won't reduce any score. Rather, you will reduce your time, because
Okay.
reading for the question, you have 1 minute in the door. But if you can read the question 1 minute, and if you ask for the time inside the exam hall, because your time is fixed 9 minutes. So if you take time to read out the question again, that you only lose your time, but that won't lose your any mark. Definitely note it down. You won't lose any marks, because all the marks that are given in your answering way, your professionalism, and answering the perfectly, right?
Okay, thank you, sir.
Okay, welcome. No worries. Let's break the pathology station. In total, we have 2 pathology station, and as every single station comprises 20 marks. So in total, there is a 40 marks. So come to the practice session. So how the pathology stations are arranged? The same way that is arranged in the anatomy station, or that is the critical care stations, and like this is your exam hall, and this is the door, and this is the question paper, like Dr. Anchal, right? And this is Dr. Anchal.
Yes.
Okay, my drawing is so bad. Please don't mind. So
That's okay.
this is Dr. Anchal, and this is the table inside the room, and this is your consultant, and this is a chair, right? So you'll get 1 minute to read this question, right? To read this question. The question might also be a long stem. So after 1 minute, you will enter into the room, and he will ask you to sit down. He will, in this portion, the questions are not that much larger as critical case portion. So these questions are standard. So the examiner will keep you asking the questions. So he will keep asking for the 9 minutes until you finish your all questions. But always remember, still the examiner has the same question script that is in the door, and examiner itself, in the hand of the examiner itself, he has so many another exam questions, because the only portion pathology question or pathology stem is not alone. There will be some tagged another station, like this is a station. Could you please read out the question, Dr. Anchal?
Yes. A young Indian lady came back from a foreign travel with cervical lymphadenopathy, anterior triangle mass, loss of weight, and night sweating.
Okay, right. So examiner will ask you, what is your diagnosis, differential diagnosis? So you might say that might be a tuberculosis, that might be Hodgkin's lymphoma, whatever. But you'll always have to say the patient came Indian lady, first Indian lady, lymphadenopathy, loss of weight, night sweat. So might be a possible case of tuberculosis. So if you say this is tuberculosis, definitely you will lose some mark. And this is called professionalism, like the way you are discussing about any case in your exam hall. So always remember, guys, always remember, in your exam there is total 180 for the skill and 160 for the knowledge portion. So how would become 330, right? Or 20?
20.
Exactly. Out of 320, you will get 48 marks only for the professionalism. only for the professional, and this is called the professionalism. So you are
340.
yes 340 whatever 340. Thank you, sir. So there is 340, and out of 340 you have only 48 only for the professionalism, and these are the silent killer. And most of the doctors who can't fail, who fail in your exam, and you guys will all know that who are preparing for this exam, they don't fail for a long amount of marks. They only fail for 1 2 3 4 these kind of marks. So they lose their marks in the professionalism. So you'll have to have you have to give emphasis on the professionalism. So after as Dr. Anchal read out this question, and the examiner will keep asking this question, after finishing this question they will give another scenario, and that is not given in the door. Did you get this, doctor? This another scenario is not
Yes.
given in the door. This scenario is on the your examiner's hand, and they will give you now keep this read this question, and after reading this question they will keep asking you another scenario. And these portions are not, it's not necessary this the another scenario will be like this way. As my scenario, there is a testicular teratoma, and the another station is attached, that was transfusion or blood related disorders like DIC or something else. The station there is a pathologic DIC. So DIC was attached or tagged with the main station. So this another station or tag station, this station will won't have that much of questions. It will carry a small amount of questions. The main questions that will be asked you, that is that question is given in your main stem or in your wall, right? So guys, did you get it?
Yes.
Okay, doctor. So let's summarize up what we've been through. So in total, we have finished the knowledge portion. We have finished the knowledge portion. In knowledge portion, there are 8 stations. 8 stations. Among the stations, there are 3 anatomy, there are 3 critical care, and 2 pathology stations. So for the eight stations, you will have 60 marks in total. And I told you, if you get more than 150, that is your secured mark. So for the anatomy stations, you will get total 10 minutes, 1 minute to read the question, and 9 minutes for the performance. And among the anatomy and among the knowledge portion, you have total 6 stations for the critical care and the anatomy station, and this is the trump card, and this is the main portion that will make you pass. So always give emphasis on this portion. This is the easiest one. If you go through the questions or steps again and again and read very properly, I can assure you, if you can't do well in your pathology, nothing will happen. But prepare for your pathology stations, what is given in your books, traditional books, that's are okay. But always focus on this portion. Is there any question from the this portion, doctors? Knowledge portion. Is there any question, doctor?
Excuse me, Dr.
No,
Ifat.
here.
I'm Dr.
Yes,
Naim.
yes.
I want to ask something.
Yes. Yes, definitely, sir.
As far as I know, this stem will be stuck in the door.
Yes, yes.
So I will be reading the stem and reading the questions. Then I will be entering the room. And then the examiner will ask me, what is your differential diagnosis?
Yes, yes, yes.
At that moment, should I just say that key points like Indian lady, lymphadenopathy, loss of weight, night sweat? So my differential diagnosis may be
Yes, yes,
Hodgkin
yes,
lymphoma.
yes, yes. So definitely they will ask you what is the differential diagnosis. So you are not allowed to say all the things that are given in your book randomly 2 or 3. But it's always better to mention the key points. These are the key points which are along with your differential diagnosis. Key points you will have to, it's always you'll have to mention the key points with your main diagnosis, so that will lead to your differentials. so that will make your answer perfect. And this is called professionalism.
Thanks,
Why
Dr.
it is why professionalism so important, I will show you at the end of the session, at the very ending, because I'm going to show you the one most important thing that is most of the candidate who are able to see that, because that is not shown in the most of the candidates, and the thing is attached in the result. So I'll definitely show you. So I would request Dr. Hasnat, how we have, as you know, that we are going to start our course from the 24th, but the guys who are present here, is not necessary to join our course, but just I would request you, Dr. Hasnat, to break our course, how we have organized our knowledge portion, how our course will help you to break the knowledge portion, then we'll come to the skill portion. Are you here, Dr. Hasnat?
Yes, Dr. Rifat bhai, can you hear me?
Yes. Would I stop the sharing or continue?
Yes, sure.
Stop or continue?
No, yeah, you can stop your screen.
Okay.
So, is anyone can say that my screen is visible?
Yes, it's visible, clear.
Okay, thank you. Thank you, first of all, Dr. Rifat bhai, for giving me the floor, actually. So it's so generous and truly an honor to share something like excellence for Mrcs Osce platform, actually, with him. He was my mentor once in FCPS, but with time, he became more of a big brother to me, actually. That's incredible. So as all of you know, guys, doctors or Mrcs Osce candidates have already got an idea, whoever are in the group. Me and Rifat bhai, I'm going to share some ideas. How can we help your Mrcs Osce preparation and make it way smooth? I think it will work. So just a week back, we have announced to launch a complete preparation outline from the excellence for Mrcs Osce. So how's this relevant to you? So we will arrange 45 live interactive classes. None of the classes will be recorded or something like that. No old classes or nothing else. Every classes will be live and interactive. And following that, 25 live interactive mocks in every one or two classes. After that, there will be live interactive mocks where our participants will be able to share their ideas, their knowledge, yeah, immense chance to practice. So practice is the key which actually needed to crack the exam. So we have included 25 plus mocks. So for that, and we're gonna launch a book with latest recalls and questions, and we'll give and we'll provide our enrolled participants both hard copy and Google Drive access up to available. And you will have the access to drive materials, classes, and mocks until you pass. So it doesn't matter actually whenever your exam is and when you enroll us, it doesn't matter. If your exam is next year, so it doesn't matter. You keep practicing with us. That will make you finer and sharper. So you will have access no matter what until your result day. That's all we can assure you. So we will have continuous support in Telegram group. Obviously, the group with our enrolled participants, so that there is no confusion, or we will answer any kind of queries with highly experienced mentors like whatsoever. So this is our schedule that we have thrown in our group last week. Actually, all of you have seen this. This course will start from 24th of this month, and we hope to finish within 15th of July. So that roughly includes 3 months and 20 days approximately. So we're going to start our courses with applied surgical science and critical care. So we have included 8 live classes and at least 2 to 3 hours until all of the participants get clear concepts. So all of the classes will be live and no recorded class once again, and everyone will be free to ask any kind of questions, any sorts of questions until they get the clear concept actually. So there will be no recorded class. All of the classes will be at approximately 9 or 9:30 p.m. at night at Bangladesh time, and it will run for at least 2 to 3 hours actually. And for after 1 or 2 classes, we will arrange 7 live interactive mocks after every 1 or 2 classes, where enrolled participants will have the floor to practice with each other. So it will bring their fluency, bring up their knowledge and some of their skills as well. I hope that will work. So in terms of anatomy questions, we have 7 live interactive classes with 3D picture demonstration, and following that we have 5 live interactive mocks after every 1 or 2 classes with updated recall picture and updated live anatomy pictures. So as Rifat Bhai said that anatomy pictures are hard not to crack actually, but if you want identify the region or the structure, you will get it through. And if you can ensure the structure, you can easily finish the station within 5 or 6 minutes. So you will have extra 3 or 4 minutes in your hand actually. So all of the classes and mocks will be interactive, and we have left no doubt for our participants. So participation and practice has no alternative to pass the exam. If someone says that he has aced the exam by only reading home alone without proper guideline or any direction, he is someone either exception or so phenomenal, or he's just crack. So in terms of pathology, which I personally say this is a nasty station actually. So for that we will have scheduled 8 live interactive classes and 4 live interactive mocks for our enrolled participants. No matter what, if it demands, we can increase more classes on pathology actually. So it will depend on the demand and our and participants' contribution actually. If the demand, so we already promised that we will provide continuous and non-stop support. So if the demand arises, we will absolutely ensure whether it is online or offline mock to clear and to make it smooth to our participants. So 31st May 2024, I hope by the time our knowledge portion will be finished with at least 1 mock from every stations. So for the first time ever, we will arrange a grand offline mock on knowledge. So I don't know actually, was there any kind of or any sort of mock, offline knowledge mock in Mrcs Osce preparation history? So no matter what, candidates from abroad can participate by Zoom, keeping us on online. So distance won't be a problem actually. So they can participate with us sitting anywhere in the world, I can assure you. So for this purpose, this was our course outline from this month to July 15th. Actually, it will run continuously. Knowledge after skill, then knowledge will come after skill, then skill will come after knowledge. This will run cyclically actually, and whenever you get enrolled, you will get the access to our every materials until you pass. That's all I can say for the knowledge part regarding our course actually. So our hugely experienced mentor, Dr. Rifat Bhai, and I, and with being by the side of him, I will try also something to deliver some of my little knowledge actually with future Osce aspirants to help their journey actually. So I think it actually works. So I am inviting the questions against me regarding our courses, upcoming courses. Is there anyone?
Hello, Dr. Hasan, I have a question for you.
Yes, sure, you can.
Okay, as there is a Ramadan, so I think the class time will be better if after 10:30 or 10:30 then 50 p.m. because I have to
Uh,
complete my
uh,
prayers, then I can be able to
uh,
join the class.
I get it, doctor, but
That's for Ramadan purpose
okay,
only.
I get it. For all the purpose, we can start by 9:30 or 10 p.m. Actually, as most of our doctors may be in duties, or some of them uh, again go to the bed as they have to get up early in the morning or for seri purpose actually. So, and the classes will be recorded, so you can get it after the class. But please make sure to join in the live class. We will appreciate your presence actually. So it will give some ideas to some live interactive session actually. So it will help to gain, but or to get the knowledge what actually happens in the actual scenario. So I think it will work. And if any confusion arises, you can actually ask back instantly in the live class. So I think it will help actually, and you will share some knowledge from your ideas. So we can also put some information in our memory actually. So I think it will work. But yeah, as per your request, we can actually start our classes in the Ramadan 30 minutes or 1 hour late, I think.
Yeah, mostly it will be good if 10 p.m. Inshallah,
Sorry,
I'll
doctor.
be then okay.
Sorry, doctor, your mic wasn't clear.
It will be okay if the class will start at 10
Okay,
p.m.
Dr. Russell, I think because all of our classes, because it's a tight schedule, right? So as you, one of my previous student also. So as you know that I always, or Dr. Hassan always prefer to understanding of the topic. So every single class will take 3 hours at a time, minimum 2:30 to 3 hours minimum. That might take 3 hours, 4 hours. Even I do have experience to take classes for the long 12 or 13 hours at a time with a break of 30 minutes. So time is not a factor. But if we start after 10 p.m., because all of you yourself, I know you very well, and I am a one of the I'm a CEO of a most busiest unit of BSMO. So I do also have do have works to attend the 8 p.m. So if you guys start that after 10 or 30, 10:30 or something else, so it will take to finish the class at 2 p.m. or something, but it would be very difficult for us. So I think it's preferred to, as Ramadan has already been done already, more than 50% has already have done. So I think it won't be a big deal. Only for the 10 days we'll try to start our classes within 10 p.m. and after 10 p.m. On when regular schedule come, then we'll start at 9 p.m. So it won't be a big deal, brother. No problem.
Okay, it will be great.
Okay. So may I share, Dr. Hasnat?
Yes, doctor, you can.
Okay, guys. Now come to the most important one, and as well as the most difficult one. Though the thing is not difficult itself, but most of the candidates who fail in the exam, those candidates fail in this portion, and this is nothing but skill portions. I would always say skill is not that kind of thing that you will able to develop within a day. Skill is that kind of thing that will take to develop, and whenever you will keep practicing again and again and again, and always under the supervision, who will find you, or who will judge you, and who will criticize you after having the station. So by that way you will become a skilled person. So always remember, skill is the easiest one if you keep practicing, and if you can't practice, definitely the portion will fail. That is nothing but skill portions. So let's break the skill portions. Station distribution of the skill. There are total how many stations, doctor? Is there anyone who can participate with me? Someone, please. I can I can
Nine. Sorry, 9.
you guys know that I can continue my class without without having the conversation. So who is this, Dr. Anava or Anchal?
Achal, sir. Yeah.
Oh, okay, that's great. Okay, that's great, ma'am. Total there are 9 stations. 9 stations. Out of 9, 3 stations is examination, 2 stations history taking portions, 2 stations the communication, and 2 stations for the procedure. Total 9 stations. Among the 9 stations, the most important stations is history taking stations and 2 procedure stations. These are the most important. Why this is the most important? If you are well prepared regarding the history taking stations and the procedure stations, here total 4 stations, 4 into 20, and there is 80. And if you are well prepared among the procedure stations and the history taking stations, you are able to achieve more than 70 marks out of 80. So you have total 9 stations, total 20 marks per station, 180 marks. So how much mark do you need to pass for the skill portion? I have seen so many candidates and so many results in my life, on my short life. I have seen the cut mark of the skill portion was 116, 118, 120, 122, 123. But I have never seen to go the cut mark of the skill portion more than 125. So the cut mark, the safest portion of the passing mark is nothing but 125. So if you can achieve the 125, that will definitely make you pass. So in case of your knowledge portion, you will focus, will have to gain more than 150 or 150, but in case of knowledge portion, you'll have to gain 125 or more than 125, and that's your secure mark. So come to this portion, next portion. One is the history taking portion, is the most important, and another one is the procedure, because there are almost 21 or 22 history taking portions, stations in your book, and only 6 stations in your book. Though it is said that in RCS, one is the person procedure, like nevus or abscess or something else, and another one is the performing or procedure type. So like knot tying or like OT listing, those things are called performing procedures, whatever. But always remember, there are 6 stations which is fixed in the procedure, and will definitely get 2 stations out of 6 stations. So that is that much easier. And if we have arranged some way to teach you the procedure skills, procedure stations, and Dr. Hasnat arranged the book so nicely. I was so surprised how a person can arrange the procedure stations so nicely. So I am grateful to Dr. Hasnat. He compiled the history taking books so nicely, as well the procedures books so nicely. So whatever, whenever there is 10 steps approach, there is so many steps, you will have to look for step by step. So if you are taught by that way, you won't forget anything. So in case of history, in case of procedure stations, like you are asked to remove a abscess, so your main job is to drain the abscess, right? So other than the draining the abscess, you will have to do so many works. You will have to introduce yourself, you will have to take the consent of the patient, you will look for the WHO safety checklist, you will have to wear the gloves, wash your hand, and so many things. Then we will allow to perform the abscess. But after doing the abscess, you also have to do so many works. So the marks that are distributed among the procedure, that is not only for the procedures. Few things you will have to do before starting the procedures, few things you will have to do after doing the procedure, and while you are doing the procedure, you will have to do so many things, like you will have to tell the patient what is the danger signs of the abscess, when we will look for the medical attention as soon as possible, whether you will take any antibiotic or not, or so many things, whether there will be any scar or so many things. Those things we will have to. So this thing won't develop in a day. That will take some time to develop. Right. Now come to the history taking portion, though I will discuss those things again. There are 22 history taking portions, and there are out of 22 history taking portions, you will definitely 2 stations. Now come to the portions again. Mark distribution is taking. We already said there are 9 stations, 20 marks each, 180 marks in total, and pass rate depends. And I said pass mark is 125 is the safest one. Okay. Time distribution from the is most important. It's very, very, very important. Time distribution on the skill part except communication station. In total, every single station you will get 10 minutes for every single stations. Definitely 1 minute to read the question, and 6 minutes to perform the station, and 3 minutes to have the cross questions. But this time distribution varies. This thing is not same in the communication session. I'm breaking individually. Let's go. Time distribution of communication. I already said I'm discussing this thing later on. At first, there are 3 examination stations. How many examination stations? There are 3 examination stations. And I would say examination stations, it also a good stations if you do the examination again and again, because these things are fixed, and there are 2 type of patient you will get in an exam. One is the real and another one is the actor. But I always prefer book those kind of centers where you will get the actor, not the real patient. In case of Indian stations, they used to bring the real patient, but in case of the Malaysia, especially Malaysia, Bahrain, those areas, they won't bring the real station. Why I am saying it? Like 1 year back in India, Chennai, there was a patient who had varicose vein, and there was a lipodermal sclerosis, a big lipodermal sclerosis and a big ulcer. His leg was so swelled up and so many features was present in the patient, and patient was almost more than 130 kg weight. So is it possible to examine, if especially for the female candidates, is it possible to pull up the leg just above your shoulder, or and pull the patient for the 3 or 4 times to see the swelling, or to see the valve competency? Is it possible to you? And is it possible to describe the lipodermal sclerosis so perfectly? Is it possible to describe the swelling so perfectly? Is it not possible? It will become so difficult for you. But in my real exam in the Malaysia, I got a patient who had submandibular gland swelling, and the examiner asked me to examine the submandibular gland, and that was a medical student. My examiner asked me, suppose the patient has a submandibular gland swelling, just examine the patient. And the medical student acts like that was written in our book. So I just follow the instructions. I step by step, every single thing I have focused, and my examination was done within 4 minutes. So which scenario was difficult, the varicose vein or the submandibular gland? Guys,
Obviously,
are you
the
there?
varicose vein.
Huh? Is it varicose vein is the easiest one or difficult one?
Obviously, the varicose vein, like
Varicose vein
Is the
difficult
difficult?
one.
Exactly, is the difficult
Yes.
one. So it will be very difficult to examine. So I always ask you, or I always prefer you to book those type of centers where the real station is less, but is not that you won't get any real station in the Malaysia or other stations. You will get patient there, but not that much are found in the India. So always this. So come to the examination, how the examination station is conducting in the real exam. So there are total 10 minutes, right? Total 10 minutes. This 10 minute is divided into 3 portions. 1 minute to read the question, 6 minutes to perform the examination, and 3 minutes to have the cross questions. Like at first, this is your exam hall. And this is the gate, and this is the question, and this is Dr. Anava. Dr. Anava, could you read the question, please?
yes, Bhaiya. A 55-year-old man who is on 8th post-op day of right hip replacement complains of sudden onset of chest pain and difficulty of breathing. Considering this clinical examination station, you are asked to carry out respiratory system examination of the patient in order to help him.
So this is the question, and this is the real scenario that will be fixed in your exam hall. So you took 1 minute, and while you found that this is the respiratory system examination, so it will take hardly 15 seconds to read the question. So rest of the 45 seconds is your job to recall the examination step, especially the steps of the recall the examination. And definitely in that case, you will be provided COPD patient. So you'll have to recall what will be finding, what are the positive finding you will look for, what are the steps you will do. So 1 minute done, you enter into the room. In the room, this is a couch here, this is the couch, this is a table here, and this is your examiner sitting here. You enter into the room, the examiner will getting you and will say, my sir, good evening, my candidate number is 390. The examiner will ask you, have you read out the question? Yes, sir. So he will show you, this is your patient, he is lying down here, and there will be table here, so many instruments will be kept here. So the examiner will ask you, this is your patient, just do the examination. So you'll come to here, and the thing will do the thing you'll have to do in your uh, respiratory system examination. You'll have to proceed the normal way. So this is the way. So you took total 6 minutes here to examine the patient. After 6 minutes, whether you have done the examination or not, the bell will ring and will have to come here, and the examiner will ask you to sit here. So most of the time I have seen and I have heard, examiner might come here to see you what you are doing, or might not come here. He will just keep observing you by sitting here. He won't come to see you. He will observe from here by sitting. So after 6 minutes, you will have to come to the table, and the examiner will ask you, just would you like to present the case, or like the positive finding, especially you can, whatever you want, you can present the case or the positive findings. Then the examiner you ask you some few questions. Those are the questions are fixed. What's your differentials, how you investigate the patient, and how you treat the patient. So you will get, the examiner will ask you for the 3 minutes, and if you are very well in the station, the examiner might ask you the questions that are not given his answer script. I don't know what is it happened in any other examiners station, but I've faced this type of questions in my exam, in my especially for the shoulder examination, my examiner keep asking so many questions, and in the submandibular examination, UK examiner was keep asking me a question again and again. Those things are not given in his answer script. So I think if you can perform well, they will to give you so many marks, they can keep asking you so many questions. So by this way, your examination extent will be finished. So did you get this, Dr. Anava, or the doctors are here? Did you get this, guys? How
Yes,
the
ma'am.
examination station is running? Okay, so you will get 3 questions, 3 stations here. So 60 marks here, right? Now come to the history taking stations. I have already mentioned history taking stations is the easiest one and the important one. So itself, it has 20 marks. So you will get 2 stations, so total 40 marks, 2 stations, right? This station also have 10 minutes, 10 minutes. So 1 minute, 1 minute to read the question, 6 minutes to read real or the patient to taking the history, and another last 3 minutes to have the cross questions. In this way, this is also exam hall. Is Dr. Russell here? Is Dr. Russell here?
Yes, Dr. Ifad, I am here.
Okay, brother. Okay, brother, no problem. And this is the door. The question is written here. So this is Dr. Russell. This is Dr. Russell. So would you please read out the question, doctor?
Okay. Considering this history taking station, you are take the history from a 36-year-old lady in a pre-op clinic. She has been admitted for elective laparoscopic cholecystectomy. She is breathing heavily and sweating a lot. She also looks afraid and scared.
Okay. So you took to read the question only 20 seconds. 20 seconds. You read the question. And you found the patient is breathing heavily and sweating, looks afraid, is scared, and this patient is having breathlessness or something else, and patient is scheduled for the laparoscopic cholecystectomy. So it is nothing but anxiety.
Anxiety disorder.
Exactly. Breathlessness for the anxiety. So you just took 20 seconds to read the question. So rest of the 40 seconds, I would always prefer rest of the 40 seconds, just recall the differentials. What are the differentials here? Just say the differentials chronologically one by one. Just nothing else. What are the differentials? Whether there is a pulmonary embolism, respiratory infection, malignancies, or something else. What are the differentials? So just think all the differentials and arrange chronology those things. And after finishing the 1 minute, you enter into the exam hall. After entering the exam hall, you will get 3 guys. One is here, one is here, and another one is here. And Dr. Russell is this. As soon as you enter into the room, this is the surgeon and this is the layman examiner. The surgeon will ask you, have you read out the question? Yes, sir, I read the question. So he will show you, this is your patient, start your history taking station. So you will sit here, and will start your station. So in this portion, the things are fixed. There are so many things you will have to do, because this is a patient, this is a person, layman examiner, definitely he or she has some role to be presented here. That's why you will have to so many things strictly, so many things that are what to do or what not to do in the history taking portions. Those things are very important. But if you are well prepared and know the way how to take the history properly, I can assure you, you will definitely get more than 18 or equal to 18 out of 20 marks, because history taking portions is fixed, and if you follow the portions, and definitely will get the marks. definitely nothing to worry about, because these things are the fixed. So you will, after having the history, the bell will ring and the examiner will ask you, okay, whether you have done with your history or not. The examiner will ask you, okay doctor, would you like to tell the positive finding or tell the presentation or present the case? So choose whatever you want. So after this thing, the examiner will ask you, what is your differentials, how would you investigate, and how would you treat the patient? That's all, and nothing else. They won't ask you anything else other than these 4 questions. So what the role of this person? You are taking history from this portion, you are talking with this person, and you haven't done anything with this person. So what is the role of this person? And she is not a surgeon. She is here how competent you are to communicate with the patient, whether you are using any medical jargon or whether you are using a medical term that is not a familiar with the patient. Definitely she is here to lose your mark, because she has some marks in her hand. So whenever you are not competent to take the patient, you are not taking the history with a full pace or confidence, you are not fluctuating your voice, like patient is very worried and patient is like crying, or patient is describing about his illness, and if you are taking the history so loudly with a smiling face, you will definitely lose some mark. So this thing we are not able to do. So this thing is very important. So but I can assure you, if you are well prepared, definitely you will able to get 18 or more than 18 out of 20. So that's all about the history taking. Is there any question regarding the history taking portion, guys?
Uh, excuse me, Dr. Ifat, can you go back to the previous session?
Yes. Please mention your name, then ask the question.
I'm Dr. Naim. In that
Nice to
case,
meet you.
what history I should be focusing on? Like, should I be focusing on, as she is here for laparoscopic cholecystectomy, so should my history be focused on that portion, or that she is breathing heavily and
Okay, just
sweating?
look, though it is not our topic, just I took a example, nothing else, an example. But as you are asking me, just look that she has been admitted for elective laparoscopic cholecystectomy. That means patient has already been diagnosed. She is for the laparoscopic cholecystectomy and she has been admitted in the hospital. So she is already been diagnosed. After admission in the hospital, patient is having breathlessness, sweating, like sympathetic overactivity. So patient is already been diagnosed. So why would you like to ask the questions regarding the gallbladder? Is it logical? It has already been diagnosed.
No,
Patient
I was
is admitted
thinking like
the operation.
asking about her comorbidities for
Those things
preparing the
you
patient.
will ask. Definitely you will ask, you are allowed to ask those questions after getting the after finishing all the differentials. Then you are allowed to ask the comorbidities or any medical conditions. Those things are the fixed. I will, if I get the chance, definitely I'll show you how to take the history. No problem. Is there anyone who has the question? Are you clear, Dr. Naim?
Yeah, thanks, Dr. Ifat.
Okay, very good. Is there anyone who would like to know anything? Dr. Anchal, do you have any question? Dr. Devalina, she was doing tremendously well in the last mock, and I was just talking with Dr. Hasnath that she was doing very well in the last mock.
Thank
Dr.
you.
Devalina, do you have any question? Yes,
No
Dr.
questions as of now, sir.
Okay, that's great. Okay, come to the procedure stations. In case procedure stations, the marks are divided differently, or the times are also divided differently, because how the procedure stations I have already mentioned, there are 6 procedure stations. Like among them, one is OT listing stations, one is abscess, one is nevus, one is suturing, one this way, one is a cut injury or something else. So what really you will have to do in the procedure stations? So in the OT listing stations, the time is fixed. 1 minute to read the question, and you enter into the room for the whole 9 minutes for asking the questions or rearrange the scenario. In abscess, nevus, suturing, in case of suturing, same thing. Just you will read the question, you will enter into the room, the examiner will show you different 3 questions, he will allow you to wear the gloves, and he will ask you to note, give some notes, and while you are giving the notes, he will keep asking you some questions. Now come to the most favorite and the most important stations, the abscess, nevus, these things. So like this is an exam hall, and this is your examiner, this is your examiner's table, and this is your examiner, right? And this is a bed, a patient is lying over the bed, she is the patient, and she has an abscess here, and this is the abscess, right? And this is the door, and this is the question paper, and this is who is she? This is Dr. Devolina, right? So you have 1 minute to read out the question. So would you please read out the question, Doctor? Dr. Devolina, are you here?
Yes.
Okay.
Considering this procedure skill station, you will be asked to do the excision of a nevus and related questions to determine your knowledge.
Okay, so it's the nevus station, not the abscess, right? So you read the question 1 minute, and just you took only 10 seconds or 15 seconds to read the question. So always remember, after having that, and the job of you to rearrange what are the steps are you will have to perform in removal the nevus. So after entering the room, what are the things you will have to do? I'll definitely is stage that this is a stage of performing, and that's the reason why female doctors are passing more than male doctors, because they can act more perfectly than the boys, right? Are you agree with me? Doctor, are you agree with me? Are you here?
Yes. I'm not very sure about that, but
Okay.
yes, maybe.
Okay, she is not agree with me because she's a female. Okay, she entered into the room. The examiner will ask you, have you read the question? Yes, sir, I read the question. Okay, start your procedure. So this is your patient has a nevus, and this is a chair here, and there will also a person who will be present in the station to help you, always remember. And this is a table or something else that will keep just besides you, and definitely a person will present here. She will help you to accumulate your instruments, whatever you need. Whenever you will ask the patient, like it's the nevus station, so we'll have to give the some stitches, so we'll ask the help the attendants to cut the knot or something else. So definitely, so give you the suture materials or whatever you need. So definitely there will be table here to keep the instruments, and there will also person who will present here to help you. So you sit here and start your procedure performing. So what's your job? The thing will have to follow that I will let you know at the procedure station. But always remember, one thing you will have to know, that in this portion there is no extra 3 minutes to read you the questions. Always remember, there is no extra 3 minutes to ask you the questions. While you are sitting here, you will doing the procedure, all the 9 minutes you only do the procedures, but the examiner will ask you any questions, definitely he will ask you some questions. While you are doing the procedure, while you have exercise the nevus or while you are giving the incision, the examiner will ask you, keep asking you some questions. So is it really possible to concentrate as a time to answer some questions to the examiner and giving the incision or removing the nevus? So it would be very difficult if you are not very professional one. So there is some way to ignore these things. Definitely I will let you know in the exam. So what if, just rather than if you have started the excision of the nevus and you are start talking to the patient, then examiner won't get any opportunity to ask you the question. So keep busy yourself to talk with the patient so that examiner won't, and you please don't give the examiner to find any slot to ask you the questions, because because if you can't answer anything, you won't definitely lose some marks or your standard. Definitely that will bring some bad impression. But if you keep talking with the patient, the examiner won't get any opportunity, because you are only here to do the procedure, not asking the patient, doctor's questions. Though he will ask you some questions, but if you keep busy or if you start talking with the patient, the examiner won't get any slot to talk to you or ask you any questions. So how to keep the patient busy? Definitely I will let you know in the classes. So is there any question, doctor? Is there any question, Dr. Dabulivna? You are the person who...
I wanted to ask something. Like, suppose
Yes,
there is a
definitely,
patient
doctor.
with a nevus. So I
Mhm.
don't think there will be actual patient with an actual nevus, right?
Okay, that's is now. If you go through our group, I have given few makers or few dummy that are for the nevus. So like this is a patient's hand or patient's leg, whatever. Like so, this is a patient's right, right thigh. This is the knee joint and this is the patient's leg, right? So
Yeah.
there will be a maquette here with an artificial abscess which will be attached in his lower thigh by the
Okay.
soil.
Okay, I
And
understand now.
she will be wrapped, painted and wrapped. The nevus or abscess will be open here. So you will just cut over the dummy
Okay,
and
so
will
we'll
drain
be
the abscess and
operating
nothing
on
else.
a dummy attached to an actual person, an actor.
Actor patient,
I understand.
exactly, actual patient or actor patient, but at
With a
the
dummy,
dummy is
dummy
attached with the
disease.
patient.
Yeah, okay, I
Yes.
understand now. Thank you so much.
Okay, if you go through the our group, you will come to know that few dummy or makers have been given there. You can able to know that. Okay guys, now come to the last portion, because we have finished almost all of our skill portion. Now come to the most difficult one, and that is nothing but communication. You will get two communication stations. There are either two communication stations, and I have mentioned there in the headline is the toughest part. One is person communication and another one is phone call communication. In your book, there are 7 person communications almost, and there are 7 phone call communications, and be sure about that. You will get 1 person communication out of 7 and 1 phone call communication out of 7, and be sure about that you won't get anything other than these 7 stations. So stations are fixed. Still, this is the toughest one you'll get throughout the Mrcs Osce exam. Why this is the toughest one? At first, come to the person communication. This is the person communication. In person communication, there are 2 rooms here. This is the one room and this is another room. So, and this room is preparation or preparatory station, and this one is the performing station. In the preparation station, you'll get one question that is attached in the room, and this is one examinee. 1 minute you'll get to read the question. After 1 minute, she or he will enter into the room, and definitely she won't anyone in this room. Rather, there will be table here. This is a table here. and there are branches of the question papers or patient's file here. So as soon as you enter into the room, this is you and this is a table, and there is the paper here and there is a pencil here. So this is the prepared station. Like our first station is, this prepared station is Dama subcapsular splenic hematoma. So in this station, in this portion, in the table, you will get minimum 10 to 15 papers over the table. There will be some patient's presentation, patient's history, patient's clinical examination finding, patient's investigations. Among the investigations, blood investigations, X-ray investigations, ultrasonogram investigations, and so many things will be written here. And few referral notes, and especially the font of the investigations or font of the referrals are not that much clear. These things are written here. These are not typed. These things are typed, but in a different way, Italian or so so different way. So you won't be able to read properly. These things you can read here. So it's quite difficult to make a self note from 15 papers within 9 minutes. Is quite difficult. So always remember, whenever you found the splenic hematoma, the things are fixed. Patient who went for a who went for a match, see a match, football match or something else, and fall down from the stairs, and he become faint, and he was also drunk, and he was taken to the hospital. And investigation shows that subcapsular hematoma ultrasonogram, and his blood count has been dropped by 2 gram, hemoglobin dropped by 2 gram. These things are the fix. So you will have to know, because I have already mentioned that there are 7 stations. So if you know the case road, because case note are in our hand, so if you know the case road very properly, just cross check the papers that are written here, whether the blood count has been dropped by 2 gram or not, whether patient is subcapsular hematoma or something else. Just cross check those things are written the way you know. So everything you know. So your work is to read the paper only, nothing to note down here. You can just note down the blood count or something else, vital information, your role, or the patient's profile or something else, patient's name, age, something else, because these things won't be same. So after having the 9 minute, you will come here, and in the second, so it is the prepared station, right? So in the performance station, this is the door, and this is the question paper again, and this is you again. There will be another same question paper here. You are allowed to, you will get 1 minute to read the question, and after finishing the 1 minute, you will enter into the room. So what is the real scenario of the inside the room? So this is a table here. There are total 3 persons. This one is the surgeons, this one is the layman, and this and this one is the patient, right? So whenever you will enter into the station, the examiner will ask you, are you prepared, doctor, for the performing this station? Yes, I am prepared. So he will ask you, this is your patient, do your station or counsel the patient. So this is you. So there are, in total there are 4 persons. So you will, this is the only thing you will talk with the examiner, nothing else. And this person won't definitely talk anything with you. He won't ask you any questions. He won't ask you any questions regarding the exam or nothing else. He definitely won't talk to with you, not even a single word regarding the exam. So you will get 9 minutes to have this station, to finish this station. We'll keep talking with the patient from the very beginning, and we'll counsel the patient for the subcutaneous hematoma to stay in the hospital. So after 9 minutes and you have done with your station, you will just go back for the next station. So this station I have heard in my life, because I do have a very good relationship with the Mrcs Osce stations, not even the Bangladesh, throughout the world. And I talked about this station, and I haven't heard from any single candidate who couldn't perform very well in this station. Every one station, this station was really good, rather than angry patient. Whenever there is any angry patient, the station won't come good, because the situation was really bad. If this is the actor is very well to become angry, but if those are the cool patient, maximum time you will get cool patient. But always the candidates will say, my person communication was tremendously well, my person communication was really good, but it won't go, it though apparently it was good, but whenever the patient the candidate failed in the exam and he just go through his mark sheet, he will be very surprised that he couldn't perform this session very well. Because these 2%, why this session come very well, because the main reason, these 2% won't ask you anything, not even a question, nothing else. You will just keep talking with the actor. That's the only job you will have to do, but you don't need to talk to with the surgeon, consultant, or the layman actor, nothing else. So apparently if you are thinking that you have done, you counsel the patient perfectly, but still this patient are the silent killer, definitely they will judge you very, very, very strictly. If you can't do your job very professional way, definitely you will lose a huge amount of mark. So this is the toughest one, though you will give the station very good, but as soon as you get the mark sheet, you will be very surprised that this station wasn't that much easy, or mark was very low. This station, that's the reason why person communication is the difficult one. Okay, regarding the phone call station, I have already told you that there are 7 stations, and out of 7 stations, one is for the you will get 1 station from the phone call station. So this is you, same thing. This is the preparatory station, this is the performance stations. So this is you, this is you. You read out the question, and you enter into the room. Again, you will get 1 table here, no person here. There will be so many papers here, the same way that you get in the person communication. You will take the notes, and always remember the things are same, whether it is phone call station or the person communication station. You will always have to memorize the finding in the phone call stations. What are the information that were used to give in your post-operative oliguria, or trauma head consultant, or DAMA mastectomy. Always you have to, one thing I would like to mention, that I have myself, I just arrange the phone call stations so nicely. One picture of is given in your group. You can go through this, because phone call station is the difficult one, and it is more difficult than the person communication, because in person communication there is less number of the data interpretation are given in the preparatory station, but in case of the phone call station, there are so many data interpretation and so many information will be given. So the thing we'll have to do, you will have to prepare yourself very properly, and you will have to have a very crystal clear knowledge that are given in your in your case notes, that are given in your book. So I have compiled all the things in our book, so you can collect those things. So whatever, when you are prepared, then you will enter this room. So in this room, or performing room, you won't get anyone. Rather, this is a second performing room. This is a table here, this is a table here, and this is a chair here, and this is the wall, and there is a phone number. This is the phone number. and this is a phone here. So you'll have to take the phone number and you'll have to dial from this phone, and this is you. And as soon as you dial, the person or the consultant will pick the phone from the other side. So there is no person rather than you in this station. In this station, you will get only you and a phone call or telephone, nothing else. It's usually telephone, not the mobile telephone. So we'll ask with the doctor. So is the difficult one. Definitely, I will let you know how to perform very well in the phone call station. So come to the ending this portion. Let's break how the knowledge portion and the skill portion are arranged. And most of the stations or most of the doctors who have passed in Mrcs exam or who has appeared in the exam, they even don't know about these 2 pages. But these 2 pages are always will be attached with your result sheet. Whenever you will get your result, at first this is the first page you will get, and this is the second page. Your result will come this way. Whatever, this page is most important. Let's see. This is the summary of the last. I hope this is the summary of the last 2 hours. Let's see. We'll get 3 anatomy station, 3 anatomy station, 3 anatomy station, and there is 20 marks each. There's a surgical pathology station, 20 marks each. And this is the critical care station. Like, see, there are 3 stations. In critical care stations, the marks are not as these are given in your pathology or the anatomy. The marks are distributed different way. Clinical knowledge, clinical technique, and the professionalism. So I would always keep asking, professionalism is universal. Always remember, always try to show some professionalism in pathology also, though it is not given here, but I would always request you, always try to answer in the same way that you are used to prepare yourself in the critical care station. Always this one you have to show some professionalism. But though it is not written here, but you can see professionalism is present in the critical care portions, right? And the clinical knowledge, technique, and the clinical knowledge, whatever. Now come to the communication station. In communication station, there are there's 2 history taking stations. You can come to know that these stations are divided into 4 ways. Like, one is clinical knowledge, another is clinical and technical skill, one is communication itself, one is professionalism. So especially the layman examiner will give you marks on this portion, and the surgeon will give you marks on this portion, right? So history taking goes this way. Physical examination, come to the physical examination. So these are the physical examination. Marks are divided the same way. You do have a mark, it's a huge amount of mark in the professionalism. So if you come to the procedure station, marks is same way divided, and is the professionalism. I had told you procedure stations in the 2 types. One is patient and another one is technical. So most of the time you will get the patient procedure. They don't follow the thing. You might get 2 procedure, 2 technical, or 1 technical, 1 patient, or even 2 patients. So these things are divided in the same way, and they do have the professional. But if you go through the mark distribution, that come to this point, and this is the communication with the colleague, and that is nothing but phone call. So you do have 8 marks with the phone call only for the professionalism, right? And this is patient communication, and this is the patient or patient counseling, or so this here professional only 4, but in phone call professionalism takes 8 marks. But in patient, this one is the communication. They will definitely judge you whether you can able to communicate with the patient, whether you can show the patient some sympathy or empathy, or so many things, whether you are fluctuating your voice with the patient's sadness, everything they will judge you. And here for 12 marks, and only clinical knowledge contains only 4 marks. So I think is the most important thing. You will have to go through this thing every day so that you come to know where we'll have to give some emphasis, so you'll able to take your preparation very rapidly and very smarter way. So now I would request Dr. Hasnat to say something how our course will help to break or help to crack the skill portion, because it's the toughest one. How we'll able to help you on which way will able to help you to break the skill portion in a very single attempt. Are you here, doctor?
Yes, doctor. Please stop your screen sharing. Okay. It's almost 12 at night. Actually, Dr. Rifat Bhai already explained the real-time exam scenarios are like this actually. So actually, when I was aspiring Mrcs Osce, I didn't have any kind of these exam-like scenarios actually. So if I could have Rifat Bhai like mentor before my exam, actually, I think I think I could score more than 300 out of 340 actually. So I think Rifat Bhai will help the future aspirants to get these kind of high scores for the for our next participants actually. So basically, uh, we will arrange 5 interactive history classes where we will try to give formats of the history, and we will try to say what to say and what not to say in the history section by doing each and every history those we will find in our books. So after that 5 classes, we will arrange 2 interactive live online mocks actually, like same as before, like the knowledge portions. So we will have 5 live interactive online classes, same as that, where we will try to deliver the exam pattern and the clinical examination scenarios, order of examination, what to do and what not to do, and what about the professionalism in each step of the clinical examinations. We will try to figure it out for every candidates who will enroll with us. We hope we can ensure their professionalism, their fine tuning, whatever they need actually to pass the exam with a very high score actually. So we will arrange also 3 live interactive mocks for clinical examination portion actually. So after that, once we are finished with our history and clinical examination, we will arrange a grand whole day offline mocks, like a hands-on program. So based on clinical examination and history, like we will arrange same as the knowledge portion. We will arrange once we are finished with the knowledge portion, we will arrange a whole day offline mock with the knowledge. Same as that, we will arrange another whole day offline mock with history and clinical examination. Our abroad participants will be able to join us via Zoom or mainly Zoom platform, and they will also be able to participate, keeping us in Zoom online. So they will do the examination or history by opening their cameras, and we will actually decide or determine so what to do or what not to do actually for the exam. So for the communication skill, Rifat Bhai already explained that this is the actually easiest station in one sense, and this is also the toughest station in other sense actually. So for this, we will have to arrange 4 live interactive classes and 2 live interactive online mocks, and no matter these won't be limited in online. We will also have 2 live interactive online classes on procedural skills. So what are the tricks and tips to get 20 out of 20 in procedural skills? And we will have 1 live interactive online mock. Once we are finished with those 2 schedules, we will have 1 offline mock on communication and procedure, whole day long program on 12th of July. We hope to finish that. So that would be our best portion actually. So 3 or 4 whole day long program we will arrange to participate and to for betterment and for to how by any means we can help our future aspirants to ace the skill portion actually. So our grand offline mock on communication and procedural skill, we have scheduled a tentative day on 12th of July. So that will be our last day of our first batch actually. We hope to finish that then. And I'd like to announce a big thing actually, hands-on and fine-tuning before the exam. So it's harsh to say some of our party candidates are moving here and there for a proper guideline and getting admitted in some courses with a very, very high price. So I personally showed Dr. Rifat by some texts that have come to me that their mentors are not preparing them well. So one of my juniors has recently passed Kuala Lumpur January diet, and she was like under supervision of a renowned mentor from Bangladesh. So unfortunately, she would never suggest that anyone to go there. I personally don't know why, but that's the actual fact. Whenever she went some hands-on course, and she on the first day she came to the hotel and called me, and she was literally crying that for the last 6 months she has been worked so hard, but she currently felt that all of her hard works were in vain actually. So I showed some empathy to her, that calm down, actually give the exam with your residual knowledge. So luckily she had passed, but she has confessed that she would never suggest someone to go there and here. But I hope she will something do in do better in her career. But one thing my big brother always says that Rifat Bhai always says that our aspirants will give minimum cost and will get maximum service. And he always tries to say me and help from us. All of our aspirants will give minimum cost, and we can assure they will get maximum service and help from us, regardless any means and any other mentors who are doing mentorship for OSCE exam. So leaving that behind, we look forward to doing something great and something inspiring for the future aspirants. And obviously, who wants to pursue their surgical career up to the next level, actually. So same as before, practice is the key, but you have to practice it under a correct guideline in a correct way. So to develop a skill, it's that kind of skill that actually never grows in 1 or 2 days of practice. You need to practice again and again. So you need a partner, you need a mentor, you need time actually. So we think we could be the mentor for yourself that you actually are searching for, and you will have partners that are roaming around and will get enrolled in our courses. So we think you can practice again and again and immense time, at least 5 to 6 months. Those who are aiming for August and September diets, those they will have at least 5 to 6 months. And if they practice and follow the guidelines, we can ensure that they will definitely pass with a top score. So to execute the plan, we have to deliver a continuous and non-stop and maximum support for our future aspirants. So without further delay, I'm inviting any questions against me regarding our courses. Anyone?
Isn't there any question, doctor? Isn't there any question? Okay, I think
I have one question.
Okay,
Hello,
okay.
I am,
Sure.
hello, I am already September booking is going on. We are able to book the September in this procedure.
Yes, doctor. Some of the doctors already mentioned that in our group actually. So 2 or 3 doctors already claimed themselves that they have already booked for September Kuala Lumpur diet under RCS England.
Okay, Shubha bhai, I would like to say, why would you book your September? Whether you will able to book or not, I'm saying you. So first thing I would like to say why I am here. All of you guys knows that I have been teaching for the last 4 years almost, as soon as I got chance in the residency exam, and I have been teaching with a very high prestige for the last 4 years with the most famous academy in our country. And I just come to know that previously I knew that I taught 30,000 doctors over Bangladesh, not only Bangladesh, all over the world. But yesterday I come to know that the actual number is more than 40,000 doctors. And I come to know that more than 100 students have passed through my hand Mrcs Part A exam, and I can see most of the students are here. And after passing the exam, I come to know that they are going here and there, and they are just misguided. They don't know how to prepare. They are just running after the name or running after the fame, because when you are only one in the field, and there is no one to beat you, definitely you will be the king of the field. So I come to know that they are suffering a lot. And as I have seen that I have built up so many famous mentor who can replace me. That's why I quit on that side and started to give concentration on this clinical aspect. That's why I am here to support you. Secondly, why I choose Dr. Hasnat. And more than, I proudly can say, more than as I taught more than 40,000 students, and Hasnat is the one of the best of the best. Not only the best, is the best of the best. That's why I choose him and I invited him. Let's help the guys who are running here and there. And all of you guys would be surprised that almost more than 15 doctors have been enrolled in our course, and you'll be surprised that among the 15 doctors, I can say more than 12 doctors have already been enrolled in any other course. And among them, more than, I think, 5 or 6 candidates has been enrolled. Not only one, they have enrolled more than 1 and 2 courses. So still, whenever they come to know that I am with the Dr. Hasnat in the field, and they do have that kind of confidence, and nobody won't be able to, and nobody will be able to lead you the way I lead you to make you the pass. That's why I choose doctor. And definitely I said maximum, I will give you the maximum support with the minimum cost, because for the last few years I didn't look for the money. All of you guys, I took the classes for the long 12 hours, 13 hours with the same price, because I always wanted to give the best of my best, and money is not big, would be a big deal. So if you guys are away from me just only for the money, I would request you personally, just you don't need to talk to anyone, just give me a message. Definitely I will find you a way, though still you will have to think about us, because we are planning to give you so many efforts, so many classes with a very little amount of cost in the OSCE field. But still you are suffering from a lack of money, or you are going through a difficulties. Definitely I will come into a proper solution. So now come to the Dr. Subhos Bhaiya. He is here, and he
Okay.
is our Mrcs Part A part student. He has passed, though I can, though I don't have the ability to ask him a student, but he was in our Part A batch, and he has passed successfully, and he is registered, working as a registered in the Rajshahi Medical College, and he has completed D Ortho and orthopedics. So I can see, I can call him, he's a consultant. So first thing, I'll give you I will give you two things before, two limitations before enrolling in our course. So whether you are able to give 4 months at a time, are you ready to give me 4 months and follow me blindly? Definitely I won't let you down. I do have that much confidence. And if you are able to follow me so blindly, and if you are able to give me 4 months, and after finishing the course, if you are able to keep, if you can keep practicing for the rest of the 2 months, then don't look anywhere else, just book the exam right now. And this is your time. And I am Dr. Nahid Hassan Rifat, and Dr. Hasnat is here to help you and support you. Definitely, I won't let you to fail. And if you follow me, and I can and just keep my words, I won't let you to fail in the exam. Just you will have to focus your exam. You will have to give your whole time me, and you will have to follow me blindly. So if you can give this time, definitely will pass, inshallah. If nothing happens, and if you can perform your exam. But if you say that, Bhaiya, I can give you my whole time, I am very busy practitioner, one day I will try to attend, and another day I won't be able to participate in the mock, or I can't able to practice, or I can able to finish the studies, then I will definitely will tell you, don't book right now. You can look for the January, but you can still you can enroll the course, because as long as you keep in touch, you will keep practicing, you will gather your knowledge definitely, because you won't be able to finish the candidates are used to finish. So that's all. So, is there any question regarding me, Dr. Hasnat? Any suggestions regarding us? And definitely we'll start our classes from 24th of this month. And definitely I do have also a plan of hands-on, because I know many of our doctors are running after the name of some famous mentors, though, like there is a one mentor, and most of them are Bangladeshi or somewhere else. They are not habituated to practicing. There is one mentor from anywhere else, or two mentors, and you are running after the name of this mentor, and you are gathering more than 120 students for the 3 days, and the famous mentor will only show you 2 or 3 stations, nothing else. So definitely I would like to say, don't run after the name of the mentors, or run after the fame of the mentors. Just keep practicing. Whenever you see there are 120 participants in the mentors hands-on, but only 20 have passed in the exam. So always, we always like to shout, we always like to celebrate with the passing candidate, but who has been failed in the exam, nobody talk about those candidates. So I am committed to give you the most best service with the minimum cost. And definitely, doctors, I am telling you right now again, if you are away from money from me, and money won't be a big deal for me, because I am not that much professional to make you down. Just tell me how can I help you, and I will definitely come into a solution. So dream, commit, and succeed, and that is the motto. You will pass. Just follow me, and I'll make you pass in the very first attempt. Thank you very much, guys. If you do, you have any question, doctor?
Dr. Rifat and Dr. Hasnat, can I say something?
Yes, brother, Dr. Pinto. He's also my
Yes.
party student. Not only party, he's
Firstly,
also from FCPS.
thank you so much, both of you. You are nicely described the full procedure. That is so clear to us. I am one of your student, like as your 40,000 student. My under post-graduation journey starts with you. Then my MS, my FCPS, then my Mrcs, both are under your supervision. So I think I am here just only for both of you, just nothing. I think my MRCS journey, that was so easy with you. That was difficult, but that was so easy. That's why I am here with you. There is no doubt. Hopefully, we will support you both support us, and we all take the MRCS Part B Osce. Thank you.
Thank you, my brother, Dr. Pinto. He is doing MS orthopedics in BSMU, and he just called me today and he was just saying that, Bhaiya, I would like to enroll. I was just telling him, don't stay away from me, just come and blast the exam and just focus me. And I just asked him whether you are ready to give your best, whether you are practicing, whether you are ready to give your full effort for the 4 months. Uh, then he said, yes, bhai, I'm ready. And then let's start our journey together. Thank you very much, Dr. Pinto, and I'm very much grateful to you for your kind words. Thank you very much. Is there anyone who would like to share anything? Okay, I think no one is here to say anything more.
Hello.
Hello? Yes, brother. Who is this?
Yes, I'm Dr. Bibek.
Oh, okay, bhaiya.
Yes, yes,
How are
Dr.
you?
Bibek.
Yes, Rifat Bhai, Hassan Bhai, very familiar voices. I'm one of your students of Mrcs party, and I really appreciate your new journey. I have a question, Rifat Bhai. You have previously said that few stations, few centers, they provide dummy and a few provide main patients. So would you please repeat which centers provide the actual patients and which centers provide the dummy patients?
Okay. So first thing, always remember the stations that are kept in the India, usually real patients are kept there. In case of India, like Chennai, like Delhi, and like Kerala, here you will get maximum patients are the actor. But other than these stations like Malaysia, Kuala Lumpur, but there will also you will get a real patient. But think about the Malaya University. So Malaya University is nothing but a vascular center. So definitely when whoever like Dr. Pinto have booked Malaya University, KL Malaya University, KL, England, September, and his center will be Malaya University. So I can assure Dr. Pinto that out of 3 examination stations, he will get 1 station, minimum 1. If he is lucky enough, he will get 2 stations only from the vascular. What are those stations? Like one is varicose vein, sorry, one is aortic stenosis, one is arterial peripheral vascular disease. This thing. So, sorry guys, sorry. So he'll get more than 1 station, minimum 1 station, but he is lucky enough, he might get more than 1 station, 2 stations only from the vascular. So the stations are varies location to location. So if it is a very away from the university or any hospital, they usually give you some actor. So whenever you are getting the actor in your exam, you think that you are going to do very well in the exam. But if the patient is real patient, it would be really difficult. But nothing to be worried about. I'll teach you on that way, and it won't be a big deal for you. Thank you, Dr. Vivek Bhaiya. Thank
Yes.
you. Do you have
Yes.
any questions? Did
No.
you get it?
Yes. I will. Thank you.
Welcome, Bhaiya. So, is there anyone? Is there Dr. Anchal? I think she is from India, right?
Yes, I'm from India.
Okay, no problem. Thank you, ma'am.
Yes.
Thank you very much. Is there anyone who would like to share anything?
Very well explained, sir. Thank you.
Okay,
Cleared
it's
a
my
lot of
pleasure.
doubts.
It's my pleasure, ma'am. Thank you very much.
Thank you.
So, is there anyone who would like to say anything more? Okay, then Dr. Hassan, do you like to say anything more?
No, Doctor. I think you can have your final words.
Okay, I don't have any more final words because we are end of the session. Thank you very much. Just one thing I would like to recall you again. I am here to give you the maximum support with the minimum cost with a huge experience. And I am not that much professional, and I choose the best of the best, that is Dr. Hasnab. And if you would like to start your journey with me and Just one thing, remember, the effort is your and the guideline is mine, and combination of this thing and combination of Dr. Rifat and Dr. Hasnat will make you definitely pass in the exam, inshallah. So don't be hesitant. Just if you want to enroll in our course, just call me or knock me. I'll definitely find into a solution. Thank you very much. Okay, guys, thank you.
Thank you so much, Bhaiya.
Welcome, Apu.